Hey, welcome everyone to the Public Health Certificate Information Session. We're going to get started in just a few moments as we wait for individuals to come in. Just a few disclaimers before we get started. This is a webinar-based Zoom, so we won't be able to see your faces and you won't be able to come off mute. So please feel free to use the chat for any comments or questions that you might have. This will also be recorded, so you'll receive a copy of it in your inbox tomorrow. We're super excited to have you all here with us today to learn more about the Public Health Certificate. All right, let's go ahead and get started. To start with introductions, my name is Jem Doan. I am the program manager for the Public Health Certificate. I oversee all administrative logistics pertaining to the program. Today, I have my colleagues here with me. Kirsten, would you like to introduce yourself?
Sure, thanks very much. Good evening. My name is Kirsten Mijos. I am the director of the Health Sciences portfolio at Continuing and Professional Education. Tonight, for your purposes, I will be staffing the chat, so please feel free to send your questions my way.
Marcella?
Hi, everyone. I'm Dr. Marcella Gonsalves, and I am faculty with the certificate, and I'm also helping to lead the certificate as well. In addition to that, I teach at UC Davis in our Master of Public Health program and in our undergraduate courses, and I have had a career in public health program planning and evaluation.
All right, thank you so much. Christy Craig is our enrollment coach who couldn't make it here today, but she can answer any and all questions relating to the certificate as well. All right, here's our agenda for today. We are going to do an overview of the program structure, go into career possibilities with the certificate and the audience that we were hoping to serve with the certificate as well, how to get started in enrolling in your first class, finances, and then end with a dedicated Q&A time at the end. Again, though, if you have any questions, please feel free to put them in the chat. As Kirsten mentioned, she'll be monitoring throughout. We also have some poll questions to keep you engaged and interactive with us. So starting with this one, where are you logging in from today? Are you from the greater Sacramento area, coming to us locally, maybe the general Northern California area or the West Coast, the more general United States, or outside of the United States? All right, let's go ahead and end the poll. All right, so it looks like a majority of you are coming to us from the locally, which is great. Thank you for joining us today. I know it's the evening, so we're really grateful for you to be spending your time with us today and learning more about the certificate. All right, so to kick us off, we're gonna watch a video from Dr. Brad Pollock, who is the chair of the Department of Public Health Sciences at UC Davis.
Hi, everyone. I'm Brad Pollock. I'm the chairman of the Department of Public Health Sciences at UC Davis. I'm a professor and a cancer epidemiologist. I'm also a public health educator. There's been a surging demand for public health services as we transition out of the COVID-19 pandemic. The pandemic highlighted the growing need for public health professionals, and right now we only have about a fifth of the public health workforce needed in this country. In addition to COVID and other emerging infectious diseases, there are a variety of other health challenges, including those that are related to our aging population, to advancing climate change and environmental impacts, to increasing barriers to accessing health services, and to diseases that are influenced by social, economic, and lifestyle factors. I'd like to explain a little bit about our UC Davis Public Health Certificate program. We have a one-year part-time program that's been designed for working health professionals. The goal of the certificate is to increase the skills and knowledge of current and future public health professionals. For those who will not pursue advanced graduate degrees, our courses will increase your expertise in public health. They provide a bridge to public health-related master's degrees. To briefly explain what you get out of our program and where it can take you, our certificate includes graduate-level public health courses that cover the essential areas of public health. And these include epidemiology, biostatistics, the organization of health systems, and social and demographic determinants of health. You will master the competencies required for accredited Master of Public Health degree programs. All of our courses are offered as online asynchronous classes so that you can keep your day job throughout the program. Career options include working in government health agencies, working for health provider organizations, working with community-based organizations, and with additional advanced degrees, they will prepare you for academic jobs at institutions of higher education. For those of you already working, I think the certificate will expand your options for promotion and advancement within your organizations. There are so many career opportunities. It has never been more apparent how essential public health is to address some of our big health challenges and to keep the population healthy. The work we do is important for our communities. It'll be a very long time, I think, before we'll even start approaching the point where we have the needed number of new public health professionals. UC Davis is one of the top-ranked public universities in the U.S., and our public health graduate program is in the top tier. We would really love to have you come and join us for our certificate program.
All right, so as Dr. Pollock mentioned, there are a wide variety of careers you can explore upon completion of our program and depending on your existing position now and prior experience. Some including a health program manager at the state and county level, a health policy analyst, so working to evaluate current and potential policies regarding health and healthcare in your community or organization and looking at its impact. A community program manager, maybe you are interested in implementing and developing initiatives at the community level, working with low-income families, minorities, people who have chosen alternate lifestyles, and to really provide them with the information they need to make decisions about their health and well-being. A health educator or a patient educator, so working to educate people about behaviors that promote wellness and share information about availability of healthcare resources. And lastly, a research or data analyst, so collecting and analyzing data for others to make decisions and observations about population health. All right, so now that you've heard from Brad about career possibilities, what are yours in pursuing the public health certificate? We're going to launch a poll here. Are you hoping to get your MPH and apply for the next cycle? Are you considering a career change to public health? Maybe you are already in the tech industry or the education industry and want to make the change. Or are you already working in public health and are just looking to advance your career a little bit? And maybe something else entirely. And feel free to share in the chat if you're comfortable with that. Right, let's end the poll. Share out. So it looks like a majority of you are looking to strengthen your MPH application, which is a great way to do so with this certificate, since we are emphasizing the foundational skills of public health with these courses. So really glad that you're here with us today to learn a little bit more. All right. So before we get into program structure, let's discuss audience. Who is this certificate for? When creating this certificate, we had three main audiences that we were hoping to serve. Kirsten, would you like to take this slide?
I would be happy to, thanks. So apologies if you're in the chat waiting for my response, I'll be right there. I wanted to talk a little bit about current public health professionals looking to advance their careers. I wanted to let you know that one of the things that we really kept in mind as we designed this program was that we needed it to work for working adults. So this can be completed completely asynchronous, meaning on your own time. We understand that that is the future of public health, and we want to be able to support your mission. We also want you to know that as we compiled an advisory board of folks to help us build this certificate, this is a small sampling of the folks that were involved and who the organizations they represented. So we talked to folks in workforce development at CDPH. We talked to executive directors of nonprofits and federally qualified health centers to really nail down the kind of curriculum they were looking for as they thought about what folks in their organization needed to be successful and to excel in their own careers. So the point is that we have built a certificate that will really give you those foundational skills to help you impact community health. So if you're currently working in public health and really want to understand the whys and not just the hows, this is a great certificate to be able to do that. It's also another wonderful way to network with other professionals in public health and grow your network that way.
All right. The second audience that we were looking at are career changers who want to explore a future in public health. So maybe you are considering the move, but you're not ready to undertake a master's degree or commit to a full-time degree just yet. You want to be able to see what the curriculum is like, what you'll be learning before making such a big investment. And that's definitely understandable and very wise on as a student and as a customer of CPE. So our certificate is designed for working professionals, as Kirsten mentioned, so it allows you to keep your day job while taking classes with us and doesn't cost nearly as much as a graduate degree. It also allows you the opportunity to transfer those units to the UC Davis MPH program if you are accepted, if you would like to go on further and get that graduate degree, which is a really great perk of the program and why we have this partnership set in place. Our certificate also gives you the foundational knowledge you need to jumpstart your career. And again, allow you to connect with the faculty and industry experts of the field. This is a smaller knitted cohort, so it will range from 15 to 20 students. So you really get that one-on-one time with your instructor, but also peers in your class as well. Marcella, you were once at this point in your life where you made a career change into public health. How was that transition for you, and what did you wish now looking back?
Yeah, so the transition, I mean, I love how Kirsten termed needing to know the whys and not just the hows. I was working in public health and I saw these people around me with these initials after their name, like MPH, or they had different certificates or certifications. And I just kind of knew I was missing something, like we were speaking a little bit different of a language. And so it was really important to me to have flexible training and flexible education. And I did throughout my MPH, because I'm my MPH and also my doctorate. So yeah, and I think I have the next slide. All right. So the next group that we have crafted this certificate for our recent graduates who want to be competitive for our MPH program or other MPH programs or even other graduate degrees. We have been creating this certificate in partnership with the Continuing Professional Education and the Department of Public Health Sciences. The courses are nearly identical to the ones that we offer in our Master of Public Health program, but of course, made for this unique certificate and made for online learning. And a great benefit, like other courses, you can transfer courses into our MPH program if you are accepted. So 12 of the 14 units for the certificate you could transfer. And just to give you an idea, give you a little more context for our MPH program, similar to other MPH programs on a quarter schedule, we have 56 total units that students are required to complete, 40 of which are core courses that are like the ones in the certificate. So, and I believe we'll provide that MPH website link so you can take a peek if you're interested in just learning more about our MPH program, just to get a little more context of how this all might fit together with the certificate.
Thank you, Marcella. All right, so moving on to program structure now. So there are 4 classes in the certificate, and each course will be 10 weeks long. UC Davis is on the quarter system, and we will operate in the same way with these courses. This means that if you are used to a semester-based system school, you'll definitely need to be prepared for how quickly quarter classes can run. All classes are online, asynchronous, with built-in live components that will be optional to the learner. Again, we are emphasizing that we catered the certificate specifically to the working professional. We know you have lives outside of school, are working full-time, have other commitments. So we want you to be able to learn on your own time after hours. This certificate ranges in how you'll be assessed, meaning you will have a variety of lecture videos, readings, assignments, and exams. So you'll definitely need to be prepared to take on that load each week. This is a weekly progression course. So what that means is, for example, week one's module will open up on Monday, and students will have a week to complete all assignments, do the videos, do the assignments, do the readings, and whatever else before the next Monday comes around when things are due. And then the next module will open up and it'll follow the same schedule of due dates and deadlines. So while it is asynchronous, you will still need to keep up with deadlines and due dates of the course. And as a reminder, these are graduate level courses, so be prepared to study and ask questions if you haven't been in that school mindset in some time. This program is designed to be finished in 12 months, so taking a class a quarter. This is a newer certificate, so as we progress along, we may look into offering classes more frequently so that you are able to finish the certificate faster. However, at the moment, it is set to one course a quarter, and I'll get into the schedule in the next slide. All right. So here we have the schedule. We're starting with epidemiology for health professionals in the summer, and that is 4 units. In the fall, we'll have social and behavioral determinants of health. In the winter, introduction to health sciences stats. And then lastly, in the spring, health services administration for a total of 14 units, all online, all asynchronous, and 12 of those units transfer to the UC Davis MPH. All right. So now that you have seen our schedule, kind of the program structure, do you have an initial thought of when to enroll in terms of your timeline? We're going to launch that in just a second. I think that was the wrong poll question. Let's see. Let's launch this one. Okay, there you go. You should see the poll now. Your timeline to enroll. Are you hoping to enroll immediately? So in the summer with epidemiology, maybe you need to wait a few months. So fall quarter would probably be more ideal for you. Or are you looking to wait a little bit? So next year or longer? Right. Let's go ahead and end that poll. All right. So it looks like majority of you are looking to start in the summer, which is great news. This definitely is handy because our enrollment coach can reach out to you and let you know next steps, or if you need that initial bump to move on and enroll in your first class. All right, so we're going to switch gears now and talk a little bit more of into the classes in the certificate, and Marcella is going to take over here.
Okay, jump into it. Okay, so our first course is epidemiology for health professionals. And I actually added that eyeglass, what's it called? Eyeglass, the picture on there, because you will become disease, health, injury detectives in this course. That's the way I like to think about it. In addition to defining epidemiology, this disease investigation, you're also going to be learning the foundational skills and concepts to do things like disease investigations and outbreak investigations. In addition to that, looking at the major causes and trends of injuries and illnesses and deaths in the United States, because that's important to have that context, as well as how do we investigate? How do we design a study to investigate a health issue? And then what specifically do we do to describe and assess the population's health? So this is an important course to help you understand how we go about investigating diseases and injuries and illnesses. Our next course is social and behavioral determinants of health. And we know that health happens where we are born, live, learn, work, play, worship, and age. doesn't just happen in a doctor's office or just one space. And so it's important to know these different factors, how they're connected, how they influence health, and what we as health professionals and public health professionals can do about them. So this course, we will look at all of that. Our introduction to health science statistics is what I like to say is the math part of our certificate. So you'll look at how to do statistical analyses of different data sets, working with realistic data sets to give you more of a real world experience. Then look at, you're going to do that analysis, and then how do you interpret what you found and how do you write it out? Those are important skills. And different kinds of interpretations like descriptive statistics, inference, and probability. So this is important, especially if you want to work with data in any respect. Will be a really helpful course to have. Our last course here is Health Services Administration. And so we are going to be looking at the main components and issues of healthcare and public health in the United States. It's really important to get that context where we are working and how we address health and public health issues. So we'll look at how health services and healthcare is delivered, as well as how public health is delivered in the United States. This includes the legal and ethical considerations for public health and health services agencies and organizations. And then in addition to that, how do we lead and manage in a health organization or a public health organization? We'll look at essential skills to do just that.
All right, thank you, Marcella, for that debrief on all of our courses. So moving on to recommended prerequisites. So these are not required, but it is recommended that you have prior coursework in statistics. As Marcella mentioned, this really gives you a good baseline to work from for epidemiology for health professionals, along with health sciences stats. We do provide a stats resource guide, and that can be found in our questionnaire that you have to fill out in order to register for classes, and I'll get into that in a little bit. We also recommend that you have familiarity with SAS programming. You will touch on this a little bit in health sciences stats. So again, having this background is very, very helpful. And lastly, a bachelor's degree and English proficiency, as we're mimicking potentially if you were to go on and get your MPH, mimicking those requirements there. Again, graduate level courses, so understanding that these are held to a certain rigor will be expected. All right, so jumping into finances now. So if you choose to sign up for the entire certificate, you will receive a 10% discount and you will pay $8,996. If you do the per class method and pay as you go, that is $2,499 a class, and you'll pay an extra $1,000 without signing up all at once. Textbooks and course materials are additional, and that's kind of just depending on the course as you go along. And then in terms of discounts, we do offer one, again, for if you sign up for all the courses at once, along with group enrollment discount, where let's say if your organization, you and your coworkers would like to take a few of our classes, you can sign up as a group and receive a 10% discount that way. And it has to be 3 or more people in order to receive that discount there. In terms of an employer letter, we can also provide that if you're looking to have your organization pay for your education, pay for the certificate. That's definitely an option as well. And something that we work with very often with students at CPE. So if you're interested in that, we can work with you and provide that to your employer as well. So how to get started, like I mentioned previously, there is a pre-screening questionnaire before you can sign up for your first class. This is completely free, free of charge. It's just something that you need to complete in order to register. This is just really for you to acknowledge the expectations of the certificate and the grades that you have to earn in order to get the certificate. and move on to get the MPH upon acceptance. So upon approval of that questionnaire, you'll receive an email from me with links to enroll in your first class, to attend another info session if you would like, along with Christy's information, who is our enrollment coach, for her email, and along with her appointment scheduling, if you like to meet with her one-on-one and discuss your options for the course and steps in the certificate as well. All right. So this is our last poll question. You've heard all about our program. How are you feeling about moving forward? What is your next step? So we're just going to launch that now.
Jim, because I launched it early, I don't, oh, good, you're able to do it.
There
It
you go.
wasn't on my end. Excellent.
Yeah, of course. So there you go. Next steps. Are you ready to apply? Do you have more questions? Do you need to do a little bit more research? Totally understandable. Or maybe the certificate isn't right for you, and that's totally fine as well. So it looks like majority of you are ready to apply, which is great. Christy will probably reach out in the next couple of days to just get started and get some information from you if you would like to. And if you have questions, we're about to get started into our dedicated Q&A time. So that's more to it. So we'll go ahead and put Christy's information up here if you would like to take that down to schedule an appointment with her or email her as well.
I've gone ahead and put Christy's email and Calendly link in the chat, which I believe is easier to pull from. I know it's difficult to pull from slides. It's also available on our website, so I'll put that. We have, Jem and Marcella, a lot of really good questions in the chat. So when we get to that section, I'll probably just read them aloud and have you guys take a stab at them.
Yep, that sounds great. Let's go ahead and get started.
You ready?
Yep, let's do it.
Okay, great. So one question was, if we start in the fall versus the summer, does the full certificate price discount still apply? And the question is, or the answer is yes. It's basically rolling admission, meaning you can start at any point, and the discount applies for paying for all 4 courses altogether. So if you were starting in the fall and paid for all the courses in the fall, you would still receive that 10% discount.
Right, and you would just take epidemiology the next summer that it's offered, essentially. So it'll be the last class that you finish in the certificate.
Thank you, Jem. Here's one, Marcella, I think we've been talking a bit about. Will there be communication with other students during the courses?
Absolutely. And that's something that we really want to encourage. So that usually happens through different assignments, whether if we have, just depending on the course, there are discussions, online discussions where you interact with students. Some instructors may have group work, or there might be other avenues for you to connect with other students. But we know how important it is to connect with other students when you are in any kind of program. And so we definitely have opportunities to do just that.
Thank you. Jem, are there any other discounts that are available for the certificate that you're aware of?
Yes, if you are a UC employee, I believe there is a discount there as well. It's up to $200 for a class. And I think if you talk to Christy, she can bring that up for you and get you scheduled in the course as well.
Yeah.
So that there's that discount as well.
Yes, if there are other questions about discounts, Christy can certainly field them. So thank you for those.
Yep. And again, I just want to emphasize that the questionnaire has the statistic resources on there, and it's completely free to fill out. So you're basically just acknowledging a bunch of requirements for the certificate and the grades that you'll have to earn in order to receive it at the end. But it also includes the statistics resources there if you're looking for that.
So Jem, the best way to get the statistics resources is to fill out an application, and then that will download and then you'll be able to download that resource.
Yes, exactly.
And to confirm, it's free to fill out an application for the program, correct?
Yes, exactly. So you don't have to commit to anything when you fill that out. It's just acknowledging the requirements for the certificate If you then decide, yes, I would like to do the certificate, sign me up, there is associated fees that you'll have to pay for the course and for candidacy for the certificate, but that is not immediate to the initial application that you have to fill out.
Okay, so we do have a question about the credits applied toward the MPH. The question is, will I get credits toward it? And if so, how much? So be great if one of you two or both could talk through the process. I would begin by simply stating that the completion of this certificate does not guarantee admission into the Master of Public Health program at UC Davis. So it's always, we want to begin with that disclosure, but I want to hand it off to you two from there, please.
Yeah, so 12 of the units transfer to the UC Davis MPH, and so that's not like an exact or direct transfer, since our units for the courses are kind of different. It would only be 11 units technically with the way that our courses are laid out. But again, that it's only for the UC Davis MPH program. So if you're applying to other programs, you'll definitely need to check in with that respective university, send them the information regarding our courses, and it's up to them on whether or not they would accept the course credit for your MPH degree.
And then I do believe that is sort of one of the services of our program team is we are very active in assisting with those conversations. So if you are looking for course descriptions, syllabi, that kind of thing, we're happy to help. And I apologize, Marcella, please continue.
Well, good. So I was just going to say that our courses are designed with the MPH national accreditation competencies in mind, competencies that any accredited MPH program across the country will need to follow and have to follow. And so I would say, just depending on the university or place where you would want to pursue an MPH, that the coursework will likely align with something that they're required to do. So that is also another benefit of the certificate.
Okay, we have a pause in the questions for the moment. I wonder if either Jem or Marcella, if you have answered other questions in previous information sessions that you want to make sure you get some information out tonight that maybe hasn't been asked yet, but is a really common question about the certificate. I think the one that I hear very frequently was addressed a little earlier, which is, do I have to start, once a year? So the answer is no, you can start any quarter that you like that works for you. It is rolling admissions. Any other questions that come up frequently in these info sessions that we haven't gotten yet tonight?
I think those are pretty common questions that we're getting. Yeah.
I was going to say the statistics question, because I know when I went back and got my graduate education and public health training, I was, I'd been out of school for a while. And so we definitely had that in mind, that folks maybe, have not taken a statistics course before, or it's been a while since they were in school. So we do have those recommended resources to help get you ready.
We did have one more question come in as we were discussing. So this is a question about mentorship through the certificate program. And it's a question about, can we connect with a mentor throughout the program? And I think what's unique about this program, and one of the reasons I love working in continuing professional education, is that the instructors in this program really understand that you're a working professional and a future colleague and want to engage with you on that level. It's probably also a little bit unique that I have my master's in public health from UC Davis as a portfolio lead. And obviously, most of the teaching faculty has not only a master's, but also doctorate degrees in in their fields. So I would say that you will probably get 4 different mentors through this program in every class, but I would also pass the question to Marcella and see what your thoughts are on kind of creating those mentor and peer relationships.
Yeah, so we won't have a formal mentor program. I'll just, state that now. But like Kirsten was saying, faculty are excited to guide you along in the course and to be a resource. And we all, I can tell you firsthand experience, we know how important it is to have mentorship and guidance. And so absolutely, if you connect with the faculty and you really want to have deeper conversations about career or your goals or what have you, they are very open and willing to meet with you, to talk more, and to provide any kind of guidance or advice. So I think the most important thing is to ask, so that we know that's what you want, because we know you're busy working professionals. So we're not going to be, necessarily going to everybody, oh, hey, let's meet and talk about, what's going on in your world, that we know, you don't have a lot of time, but let's do that. No, we're not going to do that. We definitely know how busy you are. So
I will also,
I would, oh, sorry, please, Tim.
I was just going to say, we also create a space on the Canvas site for when you're in class, you can network with your peers as well. We set up a discussion post where you can collaborate and discuss where you're from, what industry you're in, if you're private or public sector, things like that. So you definitely have the space to connect with your peers and with the instructors as well.
yes, thank you, Jem, for adding that peer-to-peer mentoring. I was just thinking faculty student, but that's definitely a part of it.
Well, and as someone working on the program as well, there has been an interest amongst our local faculty members to do some events as well. And so as we see how this cohort builds and what kind of interest we have just in the local Sacramento area, we're very interested in creating some networking events. Okay, so we have one more question, or an additional question. Would this certificate and a bachelor's allow us to teach at a community college? And I do not have the answer to that. I don't know the requirements for teaching, certainly across the board at different colleges or community college level. So I couldn't answer that. I don't know if anybody on the panel wants to grab at that. I think we tend to stay away from job requirements if we're not real clear with what the situation is. So we wouldn't be able to answer that tonight. It's a great question, but it's one that would definitely depend on the employer. I do know that the certificate, we haven't mentioned yet, would allow you to sit for the certified public health examination. So that would be another benefit of completing the certificate. So for those of you who are looking to just take the certificate and maybe not go on to get a master's in public health, you could still sit to be certified in public health. And that's a national examination, a nationally recognized examination. I would also add that there's something really uniquely wonderful about the public health community, that we're all sort of wildly passionate about the topic. And as we think about mentoring and support, it will be all around you, particularly if you're looking at joining this field. So then the clarifying question, the program alone allows us to sit for the examination, or do we need direct public health working experience to sit for the examination? We have someone on the panel who sat for the examination. Marcella, do you recall whether it required field hours or simply the class time?
Ooh, I'm not going to say for sure, because I'm not, it's been a while. So
yeah, you did some investigation of this as well.
Yeah.
So
yes. So our program provides you with the education background, but you do need a little bit of public health working experience. I forget the exact amount because it asks for a specific amount of years. I think it might be 1 or 2 years, but our program has the education for the examination.
Thank you. These are great questions tonight. Okay, so I think we could probably start to wrap, maybe allow one more minute. If someone's furiously typing, I hate to cut them off in the middle, but I know a lot of us, I saw the West Coast responses, so a lot of us may be ready to load up that 7 p.m. game, that tip off. So would direct patient care count as public health experience? So what we should do for this individual, what we can do is send, let's have, I think this seems like a question. So the question is around those hours, what counts toward that certified in public health examination. So I think at this point, what we should do is we can offline gather that information about the requirements to sit for that certified public health examination. And what I will do is I will send that to Christy, who's our enrollment coach. And then she'll reach out to you and have that information when you two connect. That's probably the best way to go forward.
All right, so we're just going to wrap up now. Thank you everybody for joining us. This is recorded, so you will receive a copy of it in your inboxes tomorrow. Feel free to reach out to me or Christy regarding any questions that you may have. All right, thank you everybody.
Thank you
so
very
much.
much. Thanks for joining us.